Should I have my implants placed over the muscle or underneath the muscle? So basically the difference is that when we put the implant underneath the muscle, we have an extra layer of cover to the implant. But there are advantages and disadvantages of each technique. The subglandular technique, which means that the implants are over the muscle, has the advantage of being less invasive, less painful, and the recovery is quicker. But ideally, the patient needs to have some breast tissue to cover the implant. And the disadvantages of this technique is that they have higher rates of capsular contracture. Capsule is a scar tissue that covers the implant. It happens in every patient. And in some situations, this capsule can get thick and cause some discomfort or even change the shape of the breast. In the subglandular technique, there is a higher rate of capsular contracture compared to the submuscular. Also, with the subglandular technique, we can expect higher rates of rippling. Is those irregularities that appear in the breast, especially in the upper pole, and it's more common with the subglandular technique compared to the submuscular because you don't have enough cover to the implant. And it's also more common in patients who had breastfed or who had lost weight or who are slim. In the submuscular technique, the disadvantages are it is more invasive because you need to undermine another layer of tissue, you need to cut the pectoralis muscle, so it bleeds a little bit more, it's more painful, the recovery is slightly slower. However, the advantages are that you have an extra layer to cover the implant, so you have less capsular contracture and less rippling. Also, for those patients who are really slim and don't have any breast tissue, it has an advantage because it provides a more natural appearance as you have the muscle to cover, especially the upper part of the implant. Another disadvantage of the submuscular implant is that you can have more displacement of the implant because you have the muscle covering the implant, and sometimes it put pressure on the implant, and so it can go upwards or it can go downwards. So you have a little bit of more rates of displacement with the submuscular one. And in the consultation, I can assess you, I can explain everything to you about the advantages and disadvantages, and we can agree which pocket is more suitable for you.